Hello, welcome my friends. So today we will continue with the topic of stridor. Okay. So in this module we will learn about the types of stridor. There are actually 3 types of stridor. Then we will learn about the causes, the different etiologies that can cause stridor. Okay, different etiologies that can cause stridors. And then regarding the management part. Okay, how will you investigate a case of stridor and how will you treat it? I had cut short it and made it concise so that it will be easy for you to understand. Okay. So let's start with this. So types of stridor. I said you that there are 3 types of stridor. One is the inspiratory stridor. The second is expiratory stridor. And you have biphasic stridor. Okay, inspiratory stridor is nothing means that stridor that occurs during inspiration. Similarly, if stridor occurs during expiration, then it is called as expiratory stridor. Okay, if stridor occurs during both inspiration and expiration, then it is called as biphasic stridor, as simple as that. Okay, so different stridors occur at different sites of origin. For example, let me show you this diagram. It is taken from Dhingra book only. So look at this diagram. So if any tumor, any pathology occurs in pharynx or supraglottis, then you have inspiratory stridor. Okay, similarly, if any obstruction or tumor or any infection occurs at thoracic trachea and bronchi, basically the bronchi, then you will have expiratory stridor. That means stridor occurs during expiration. And if any obstruction or any infection occurs at the glottic region, that is glottis and subglottis, you will have biphasic stridor. Okay, to make it simple, just remember like this: supraglottis. Okay, supraglottis is, that is above the glottic level, you will have inspiratory stridor. Inspiratory stridor. And below the glottis, that is subglottis and bronchi, basically the trachea and bronchi, you will have expiratory stridor. And at the middle, that is glottis level, you will have biphasic stridor. This much is more than sufficient. But if you want to know deeper things, that then you can remember about this cervical trachea and thoracic trachea also. So glottis, subglottis and cervical trachea, at these three regions, if any obstruction occurs, then you will have the biphasic, whereas the thoracic trachea and the bronchi, you will have expiratory stridor. Okay, so this is about the types of stridor. Now coming to the etiology, causes. There are so many causes which will make a lot of confusion for you. I had simplified this and make this as short as possible. See, first start with remember 5 headings here. So okay, I had created 5 headings here. First one is the nose. The second is tongue. Third is related with the pharynx, larynx, and finally you have trachea and bronchi. These are the 5 headings or subheadings you can say for writing the causes of stridor. Okay, in the nose, the cause of stridor is choanal atresia. Okay, so in choanal atresia, there will be total obstruction in the nasopharynx so that the patient will not be able to breathe, as well as stridor will be produced. And regarding the tongue, you have macroglossia. What do you mean by macroglossia? Basically, it is the large tongue. Okay, enlarged tongue or the large tongue. The tongue is large so that it is obstructing the airway, air passage, that may leads to stridor. Okay, and in pharynx, the lesions are congenital dermoid, so adenoid hypertrophy and tonsillar hypertrophy. Okay, as well as tumors you have. But here just to remember the adenoid hypertrophy and the tonsillar hypertrophy. These two are more important compared to the others. Adenoids and tonsils. Okay. Coming to the larynx, you have congenital, inflammatory, neoplastic and traumatic. The same way in the trachea and bronchi also you have congenital, inflammatory, neoplastic and traumatic. This you can remember easily. In congenital, laryngeal lesions are laryngeal web and laryngomalacia. We will deal with it later. What is laryngomalacia? Just remember now, there is laryngeal web and laryngomalacia. These both conditions contribute to the stridor in case of laryngeal lesions. And coming to the inflammatory part, you have epiglottitis. Something inflammation. It is related with inflammation. So epiglottis is a part of larynx. So epiglottitis, laryngitis. Similarly, in the neoplastic, you have hemangioma, laryngeal carcinoma. Okay. So if it is difficult to remember, if it is very difficult for you to remember, then you can just keep it like this. Congenital is, in case of larynx, congenital, you can remember the laryngeal web and laryngomalacia. Let me clear it first. Yeah. So you can congenital, you can remember laryngeal web and laryngomalacia. This is more than sufficient. And coming to the inflammatory part, epiglottitis, laryngitis. These both conditions. And in neoplastic, you just remember the laryngeal carcinoma alone. Okay. And in traumatic, you have finally foreign body obstruction. Okay. Now coming to the trachea and bronchi, similarly, first is congenital. Here you can have atresia or the stenosis. Or similarly, as you have laryngomalacia in case of larynx, similarly you have tracheomalacia in case of trachea and bronchi. And inflammatory lesions, you have tracheitis, there is inflammation of trachea, bronchitis, inflammation of bronchi. And if both are involved, inflammation of trachea as well as bronchi, then it is called as tracheobronchitis. Okay. Coming to the neoplastic lesions, you have tumors. Neoplastic is nothing but the tumors, right? So tracheal and bronchial tumors. And in the finally in the traumatic lesions, you have the foreign body obstruction as well. Okay. So this is the basic etiological factors or the causes that can cause stridor. Okay, you just try to remember the 5 headings here. One is the nose, tongue, pharynx, larynx, and finally you have trachea and bronchi. Okay, yeah. So coming to we have completed the types and then the etiology causes of stridor, and coming to the management. See, in the management, first you have to take the detailed history taking. Okay, from where this you should find. So site of origin, you have to find the site of origin, right? If it is above the glottis, then you can suspect inspiratory stridor. And if the patient has expiratory stridor, then you can imagine it will be below the glottis. If the patient has biphasic stridor, then you can suspect the obstruction or the tumor to be at the site of glottis. Okay. So detailed history taking is very important in this case. And you have to ask about the time of onset, whether it was congenital or acquired. If it is congenital, then it will be present since birth. Okay. Basically, laryngomalacia. One important condition which is present since birth is laryngomalacia. We will deal with it later. Floppiness of the larynx. Okay, laryngomalacia. And if it occurs after birth, then it will be most probably acquired. And coming to the mode of onset, you have to ask about the mode of onset, whether it is sudden onset. If it is due to sudden onset, then it will be most probably due to foreign body obstruction. Okay, that will have caused the production of stridor. If it is gradual in onset, then you have to suspect laryngomalacia in case of neonates, that is congenital lesion, or tumors in case of elderly people. Okay, and you have to look for cyanosis as well. This is a simple sign which you can see, that is bluish discoloration of skin. Basically, cyanosis refers to accumulation of reduced hemoglobin, right? Reduced hemoglobin greater than 5 grams per deciliter. That is called as cyanosis. So if cyanosis is present, then you have to suspect there is severe obstruction of airway due to any obstruction or any foreign body or infection, or it can be tumor as well. Okay, and any signs of trauma you can visualize from the outside, that is external injuries. If it is present or not, you have to see. You should just know about the time of onset, mode of onset, and you can look for the signs like cyanosis as well. General examination, that is basically. Coming to physical examination, you can do, and respiratory distress, you have to look for the respiratory distress as well. And if you find the saturation, SpO2 drops, so if SpO2 is dropping, then you have to maintain the airway as well. Okay, so you have to find out whether it is inspiratory, expiratory, and biphasic, as I have said to you before. And you have to look for the characteristic of stridor as well. Some stridors are characteristic, basically snoring. If snoring is present, then you have to suspect some nasopharyngeal cause. Okay, nasopharyngeal cause. And if the stridor has gurgling sound and muffled voice, then you have to suspect pharyngeal cause. See, basically these are theoretical points. Mostly in practical aspects, it will not be that much applicable, but for theory examinations, you can write these points. Okay, snoring, most probably due to nasopharyngeal cause. And if the stridor is associated with gurgling sound and muffled voice, then you can suspect pharyngeal cause. And if the patient has hoarse cry, okay, then you can suspect laryngeal cause. So basically nasopharyngeal, pharyngeal, and laryngeal causes, different types of stridors are present here. Sometimes it may be associated with fever if infection is the primary cause of stridor. Okay, if infective condition is obstructing the airway, respiratory passage, and causing the stridor, then you may find fever in those patients. Okay, infective conditions like epiglottitis, pharyngitis, laryngitis, bronchitis, etc. Okay, so coming to the investigation part, the first investigation which you want to do here is soft tissue lateral and PA weave of neck. Okay, so generally it's nothing but the X-ray soft tissue, AP and lateral view. Both views you will take to visualize if there is any obstruction that you can see in that. Okay, if it is present. Then CT scan. You can take the CT scan also to find out the lesion. And then angiography to rule out hemangioma. It's basically a tumor. So to rule out this vascular tumor, highly vascular tumor, you can do angiography as well. And then direct laryngoscopy with bronchoscopy to visualize any lesions in the larynx and the bronchi. Okay, larynx, trachea and bronchi. So direct laryngoscopy basically. And then treatment, final part is treatment. So basically in the investigation part, you just have the x-ray, mainly x-ray PA view. It's not AP view, sorry, it's actually PA view. You can do the PA view and the lateral view to find out the lesions. If you cannot visualize through the x-ray, then you can order a CT scan, and you can also do angiography if you are suspecting a case of hemangioma. Okay, and finally you can do the laryngoscopy as well as bronchoscopy. Then finally the treatment part, it's nothing but simple. You just have to treat the cause accordingly. So if it is bronchitis, you have to treat the bronchitis, and if it is any other condition, based on the etiology, you have to treat the condition. Okay, so this was about the types, etiology, causes, management, and finally investigation as well as treatment part. Okay, so with this, let us conclude this session. Thank you so much.